Hello and welcome everybody to the session on how real change happens, a focus on health creation and economic prosperity. So I'm Professor Dirk O Donnell, I'm the chair of the Health Creation Alliance, and it's my great honour to welcome you today. Thank you for joining us. The current moment offers a rare opportunity to change the health and care system, public services more generally, and actually society too. There is a key connection point between health and prosperity, and that's what we wanted to explore more today. But this is very much in line with things that we've published, for example, our manifesto or our Change NHS consultation response, which many of you contributed to, so thank you. Neil will be putting a copy of that or a link to that in the chat. But in that, we really call for a third shift from sickness to prevention to actually include a shift to health creation and embedding a health creating model of health and care within the 10-year plan. And we've outlined 10 asks to make that happen. So as an organisation, the Health Creation Alliance is dedicated to supporting change. And that's why we've arranged today's session to explore what's needed in practice. For the last 9 years, the Alliance has been leading, we've been a leading movement for health creation, made up of professionals working at many levels across a wide range of sectors, including people with lived experience of poverty, trauma, discrimination, and community leaders, all working together as equal partners, looking through a community lens to improve health and tackle inequalities. For example, by building a strong narrative, as well as our national movement, which enables implementation and spread. We feel that now is the moment to surface the whole issue of how change really happens and how it might be possible to change the way that change happens to make sure it's much more effective if we work together, connecting, aligning, creating conditions and removing barriers. So that's what we will particularly be looking at today. Final points from me is that in the days following the event, we'll email you with a link to the video. And at that point, we'll also give you the opportunity to sign up to be a member of the Alliance or opt out. We are recording this event and we would love you to keep your videos on, but if you prefer not to, that's okay. We can, that's fine to keep your video off. Please do remain on mute through the session to allow the discussions to continue unhindered. We won't be opening the discussion to the floor as there are too many people. There's already, I think, over 80 of you here now. But please do add your questions and comments to the chat and we'll do our best to feed that into the conversation that takes place. But for now, let me hand you over to Merryn Simpson, who's our Chief Executive at the Health Creation Alliance, who will be leading the session. Merryn.
Well, thank you, Dirk, for that wonderful introduction. And it is a real privilege today to be able to welcome Lord Gus O Donnell to this Health Creation Alliance webinar, alongside Dr. Priya Kumar, Professor Donohue, and Dawn Shepherd. And before I introduce Gus formally, I'd like to say a few words just to set the scene and introduce what I think we're working towards in this session. As Dirk said, health and prosperity are interdependent. There have been recent reports from the IPPR following a commission that they've been doing for 3 years, along with several other reports from other organisations that have confirmed that the UK is the poor man of Europe. We have 2.5 million adults unable to work due to long-term illness, and that's damaging our economy and it's costing lives. So we're not going to get a healthy population unless we get healthy work, and we're not going to get healthy economy unless we have healthy people. We all know, I think, that inequity is a big factor here. It's very difficult to live a healthy life when you're living in poverty. Paul Corrigan, who is now working closely with the Secretary of State, West Streeting, talks about inequality of agency, the lack of control that people have now over their lives and environments, and the fact that it's impacting so much on health. But this Labour government is mission-led, and we're expecting another announcement today. And its plan for change includes 5 missions for a better Britain. I'm not going to go through all 5 of them, but 2 of them are to kickstart economic growth and to build an NHS fit for the future. And the government is also committed to devolution of power, with a new wave of devolution deals focused on economic prosperity, but health increasingly being seen as part of the Devo conversation, and sometimes part of the deals themselves. The reason why I'm focusing on devolution is because the Health Creation Alliance looks at these issues predominantly through a community lens. We look from the ground upwards. And when you look from that perspective, you see that a significant part of the solution is about communities being connected to each other, gaining confidence and agency, and taking control. And when people take control, their health and well-being is enhanced. This is the process of health creation. We sometimes describe the change that needs to happen across our systems and politics as devolution from the ground up. And the leadership challenge is to create the conditions and remove the barriers to that. But what happens when the ground up meets the top down? Well, I'm sure we've all experienced this to some degree. Typically, they either miss each other or there's a clash of cultures. So the question that we're asking in today's webinar is, can we do it differently this time? And how can we do it differently this time? So at the Health Creation Alliance, we think that to have an effective, long-term, sustainable change and to do things differently, there is a need to change and shape a new space between the ground up and the top down change approaches, and to hold that space and to allow new relationships to develop and a new dynamic to be created and new possibilities to emerge. And that space between the ground up and the top down is what we're going to be focusing on today. Imagining what the space looks like and reimagining how to do health in that space is perhaps the most difficult thing. And it also, of course, requires a shift in the power dynamics, and that can also be very difficult for people. So this is not easy stuff. We're not trying to do easy stuff here. To help us to interrogate this a little bit further through this webinar, and this has been billed as a conversation between a number of key people that each look through at least one of these lenses and more, probably more, but we want to explore this, what goes in this space, from different perspectives or different lenses. The first is the measurement lens, the second, the policy lens, the third, the service lens, and last but not least at all, the community lens. And there are, of course, other lenses, but let's just stick to those four for now. So hopefully we'll all get some new insights and about how we might fashion this new space and what might go into it and what it looks like, and how, importantly, it might be enabled to evolve over time. So for this webinar, I will start with a conversation with Lord Gus O Donnell, and then after 15 or 20 minutes, I'll be bringing in other panel members, Priya, Donna and Dawn, and we'll continue that conversation together. And then at some point, to have a fresh perspective from your chair, I'm going to hand over the chair and facilitation to one of the Health Creation Alliance's new ambassadors, and that is George Fielding. And he will continue the conversation with having thought through what's been already said and bring a different perspective. So we'll have a fresh energy at some point through the proceedings. And we'll both be looking in the chat to check for interesting questions so that we can feed them in. So please, if you've got things you want to say or questions you think we need to ask, then put them in the chat and we'll be trying to make sure that we bring that in. And then towards the end, I'll sum up and we'll have some key points. Just to say as well that this will be an ongoing conversation. The submission to Change NHS that Durka mentioned is part of our sort of attempts at bringing together what we think might go into that space. So this is building on that, and it is an ongoing conversation. So we're trying to create that new thing. So without further ado, I'm going to introduce the first guest, who is Lord Gus O Donnell. And I'm delighted to be welcoming Gus here. Gus is a former Cabinet Secretary, the head of the Civil Service, and where he oversaw the start of a national wellbeing measurement by the Office for National Statistics. And he's an outgoing chair of Pro Bono Economics, which is a charity that uses analysis and insight from the social sector to tackle low well-being. He's a board member of the World Wellbeing Movement and has written on well-being and public policy. So, Gus, it's great to have you. So, as someone who's, is there anything you want to add to what I've said about you?
No, not at all. No, that's fine.
Okay. So you're ready for the first question. So,
Sure.
As someone who's very experienced at the top and the centre of the civil service, how do you understand the change process, and what advice would you have for us?
Well, first of all, I'd say we should recognise that we have a great opportunity now. We've had a change of administration after having one party in power for a long time. New party coming in, new ideas, new possibilities, new emphases. And what I would say is the work that I did with pro bono economics, we looked at the relationship of both parties, Labour and Conservative, to their relationship with charities, their understanding of what the social sector does. We found quite a big difference in that the Labour Party were much more attuned to it and more positive. Obviously, all MPs have a very strong connection with their communities because they want to get re-elected, let's be honest, and they need to understand their communities well. So that's a good start. But I'd say with this government, they start off, and I'm inevitably going to talk a bit top down to start with. They start off with things they want to do. And you mentioned growth, and the growth thing was the mission to have the fastest GDP growth in the G7, right, by the end of the Parliament. Something that I strongly disagree with. It's the wrong thing to focus on GDP growth, which, for example, doesn't measure any of voluntary activity at all. And you can increase GDP very easily by opening all the coal mines again. And I don't think any of us would think that's exactly what we want. So they are going to change that today. So later today, I would expect the emphasis to move from GDP growth. I mean, they won't abandon it because that would be too much of a U-turn. But the words you'll hear are RHDI, which is real household disposable income. And they'll be saying that they want to increase real household disposable income over the next few years. And that will be their target. And there'll be some more specificity about that later today. Now, for me, that's it's slightly better. I mean, what I would really like them to be doing is thinking about improving the well-being of the nation, particularly those with low well-being. And the way the ONS measure that is by actually asking people how they feel about their lives. So it's their perceptions. I think we've observed, for example, in the latest US election, the US economy was doing really well. GDP growth was high, real disposable income was high, and yet people felt bad about things. So there is a real mismatch between sometimes these statistics and people's perceptions of what's happening to their lives. And I think that is, if I were, I would say we've made a small step in the right direction. I would love the government to be saying, actually, what we're going to try and do is improve people's lives. And for me, the way you do that in PR terms is they've emphasized, let's fix the foundations. That's the slogan. I'd say, yeah, but once you fix the foundations, what are you going to do? What are you going to build on top of it? And for me, it will be about building better lives, which actually really accords with the health creation and prosperity. Because I think, what do we mean by prosperity? We actually mean people having good, satisfying lives. And all of this through measurement is the stuff we can measure now, thanks to the ONS having started measuring it back in 2012, when we have very large sample sizes, which they don't have in America. So one of the real problems in America is it's very hard to estimate how people feel about what's happening to their lives, because the one source, Gallup, that was measuring this stuff stopped doing it some years ago. So you don't really know. You only have very large, a very small sample size for that large country. So yeah, I think great opportunity. And we could go into, so how do you deliver the change now that they need? And I think that's one of the things they're grappling with is to what extent the mission-led thing is very top-down. And, you know, how do you actually turn that into a set of policies, a set of changes? How do you actually get the right level of devolution in all of this? That's important. And I think what I think you need is the government to have a clear vision. You know, I'd love the vision to be improving well-being, but it's not. And then to say, okay, let's devolve the how, right? So we specified the what, and we'll be measuring, you know, how well individual areas are doing, groups are doing, but basically devolve as far as you can to communities, to regional mayors, to local authorities, the capacity for, yeah, but what are the changes that will make the most difference to people's lives? What are the things that people really care about? And that, I think, is pretty countercultural. We are a very centralized state, and that's the way things work in the UK. And so that would need quite a big change and quite a big letting go of some of the reins of power from government. And often they talk a good talk, and then when it comes to it, you find that actually the ministers are rather reluctant to let go.
Thank you, Gus. Gosh, such a lot in that already, and you've only been talking for 5 minutes. I just wanted to, I mean, I'll come back to the clear vision and devolving in a moment, and the how, and whether that's, you know, because it's the devolving that is the, you know, we need to get right. It's how you devolve as much as just doing that. But I just wanted to come back first to the ONS statistics that you mentioned, and the I know that you've done a lot of work and put a lot of effort into measuring wellbeing, and we now have the Green Book, which the civil service used to assess different, you know, policies. But you've also said, so the civil service has the tools to measure wellbeing, but you've also said that at a political level, this is work in progress, but it's much more understood at the community level and at local levels. I just wondered what you meant by this and what the implications are. And also, I've got another follow-up question about measurements as well. But just, you know, yeah, what did you mean by that?
Well, I think, you know, David Cameron started the whole process back in 2012. You know, I was pushing very hard for it to have the ONS measure these 4 main questions, like asking people how satisfied they are with their lives, how worthwhile they are, and then measuring happiness and anxiety. So that gives you a big base and a decent way of measuring it. Because if you can't measure these things, you know, it's like, how do you know if you're succeeding or not? And it's a very democratic thing. It's not like, we're not saying, oh, this constitutes a good life, which a lot of people try to do. It's like, oh, you know, we want to tell you what it is that should make you happy, and that's what we're going to measure. You know, it's like, well, you know. And you take the real household disposable income. I mean, that could easily increase quite dramatically, but it could be that the middle and high earners do very well, and the low income groups do very badly, and still our HDI overall would look really great. And so that's not exactly success, is it? So yeah, I think measurement is absolutely crucial. Now, when it comes to have we, you know, I don't think politicians are there yet. They're not kind of as they want. They basically want to measure things that they can control completely. So, for example, you know, missions that say we're going to have X thousand more doctors or nurses or policemen, or, you know, like, these are all inputs, right? And you can control them, and you can, at the end of the Parliament, tick the box and say, yeah, there's 1,000 more community workers. We said there will be, and there are. Have they been used effectively? Have they made a difference to people's lives? You know, so that, I'm afraid, is the political challenge you have, that the politicians are very nervous about committing themselves to things which are which they don't completely control. And when you think about what matters for people's lives, there are lots of things which are not within government's control. But you know, to me, it's still, that's what really matters. I think people will understand if if, we get dragged into a big war, of course, or COVID, things like that. Of course, that will affect well-being. And given that we now have the data, we can tell you exactly what COVID has done to well-being. So it's, I think that's why we're not making much sense, not as much progress as I would like.
Okay, thank you. And you've mentioned politicians want to measure things they can control. We think that health is created, and the process of health creation involves it has a lot to do with the relationships between people. We're not the only people saying this. Hilary Cottam, Donna Hall, who's on the call, it's about the relationships and the quality of relationships. And so actually, we know that already we do have some measures of that in terms of social capital, and they are Office of National Statistics measures as well. But we also have, the Health Creation Alliance has created a framework, and we can actually measure the quality of relationships on a scale of 1 to 10 across 6 features. How do you think this kind of thinking could go, maybe not necessarily to the top of government, but might sit in this new space that we're trying to create and actually count? People might start to believe that if you measure the quality of relationships at whichever level, that it actually will help, that it will be a real sign that you are creating health and that the society is becoming healthier.
Right, and I completely agree with you. And indeed, the research by Clark and Richard Layard and people on the origins of happiness, where they look at cohorts and they look at people through the life cohort, shows you personal relationships are very important. And I think this matters a lot. But let me give you an example where I think we are completely missing an opportunity. We have a children's wellbeing bill going through the House at the minute. There's no measurement. There's no measurement of children's wellbeing in there. We've got brilliant examples, the Be Well project in Manchester, where they're actually starting to measure children's wellbeing. And people will have differences of view about precisely how we should do this, and I completely respect that. And there's not one answer to this, but to not measure it at all and to have a bill that says you're going to do something about children's wellbeing without actually saying, well, what is children's wellbeing and how are we going to tell whether we've improved it or not, is pretty crazy. And I'm working in my own little world of the House of Lords to see if we could do something about that, but I'm not succeeding as yet, unfortunately.
Well, I'm going to just put a suggestion out to our delegates that if you have ideas for how to measure that a children's wellbeing bill is succeeding, could you write those in the chat, please? Because this is a way of crowdfunding solutions or crowdsourcing solutions to some of these issues that we don't know the solutions to at the moment. Thank you for that. So are there any things we should stop measuring?
Stop measuring. Oh God, I'm a data freak, so I love data. So I'm not too fussed. I think there's some things we should stop emphasizing so much. Like a 0.1% increase in GDP. Like makes the headlines. I just do not understand why. I mean, the important thing is that why has it gone up? It could have gone up because there's a big increase in drug dealing because that counts in GDP. So there are some crazy things that the world has got used to, and I blame my own profession of economists for overemphasizing some of these statistics when the guy that created GDP, Simon Kuznets, back in the 30s, his one thing was, please don't use this as a success measure. And proper economists, I would say, know that you shouldn't do that. But for some reason, Rachel Reeves got herself bound into this real GDP thing, and I'm hoping that we can move off that as far as possible.
And to what optimism do you hold? Optimism that this government might sort of loosen the hold on this, or is that asking too much? Do we need to actually create this new space despite what might happen at the top,
Well,
or should we be trying to change what's happening at the top?
I have to say my degree of optimism has diminished. I don't think this government started particularly well, if I'm honest. I think there is still a lot of time, though. I think they can turn this round. And the one area where I will be slightly more nervous about the way the Health Creation Alliance is going at it is, to be honest, the emphasis on health. And the problem with that is that people take it very narrowly. They think this is all about hospitals and doctors. And you mentioned personal relationships. That to me is what it's all about. And I think if people think the answer to this is more hospitals, then we definitely got it wrong. And the idea that the way we should create more health is by giving more money towards treating is wrong as well. This is about actually working across departments, thinking about those things. You mentioned personal relationships. Well, that doesn't come within DHSC's remit, does it? I mean, like, how are we going to do that? It's a different thing. So I do like the fact that Health Creation Alliance is thinking about the broader aspect. I just worry whenever anybody says this is all about health, and we end up talking about, I remember Nigel Crisp, who was the head of the NHS in my time, saying hospitals are for repairs. Home is where health is sorted out, and that's been my mantra for a very long time.
Thank you. So maybe we should, that's a call to us to rethink, but our framing of this is intended for the NHS, but then it's all about the relationships ultimately, sort of behind that, and health creation, the creation of health is about those relationships. You talk as well about well-being mobility, using the idea of well-being mobility instead of social mobility, and learning from people and communities whose health has improved, which is precisely what we did and what we are continuing to do as a movement. We learn from the pockets of success. What tips do you have for delegates here in that respect?
Well, I would say the reason I emphasize well-being mobility is that for a long time people have emphasized social mobility, and that has in a sense been hijacked by the middle classes, saying social mobility is about everyone being like me. I went to university, therefore everyone else has got to go to university. That's the route through. And I think that fundamentally is wrong. I think what we should be thinking about is there's all sorts of ways of people fulfilling their lives and having fulfilling lives. That may involve university, it may involve lots of different things, creative and other aspects. And so I'm very much about how do we help those people who are stuck in if you look at life satisfaction, levels 1 to 5 on life satisfaction, to be absolutely explicit. And those people have particular issues, right, which are, and they're quite often related to personal relationships. They're quite often related to things that have happened in very early years, which is why the children's wellbeing thing is such a big opportunity. You find that if you haven't got the early years right, as I'm sure there are people on this call who know far more about this than me, that you've lost, and it takes a lot to get it back. And it's I used to head the Treasury, and for me it's like, who are the expensive people in society? Well, the ones that go off the rails, they commit crime, they're really expensive, they're on benefits, and if you can just stop that by preventing that route, and you end up with someone who's a productive member of society paying tax, not you paying them benefits, you transform the public finances. So, this is why I think it's something which should be something that Treasury really likes, and Treasury does get that, but you need a long-term vision, because quite often this involves investing money now, which is why I kind of, as part of a campaign, some of the people on the call may have noticed, writing in places like the FT to create the space in the last budget so that there was more room for investment, because we will never change things if we don't invest in improving our public services. And there is now scope to do that, I'm glad to say.
Thank you, Gus. You do sound slightly world weary, I have to say. And if there's anything that we can do as an organisation to kind of, support what you're trying to do, we're very keen to know and understand what that is. So maybe a further conversation after this, because, you know, we know that there are people all over the system, you know, in different places, different parts, that are kind of allies, and we are wanting to work together to do this and to get the pincer movements going to make some of this happen. The shift to wellness, to focus on what creates health, not just what prevents illness. And we do think that even people who have had a less than ideal start in life, we do think that, you know, their lives can improve as well. And health, you know, we've got lots of our members who that's true for. So we can come to that maybe later as well. So I'm going to
just one thing before we move on.
Oh, just one more thing. Is there one more thing you want to say?
Just one slightly. I saw in the chat there a reference to Sure Start, and very early on in my Treasury career, I worked with Naomi and Norman Glass on that project, and it's like, to me, that's an example of some of the things that government could really do, which made a big difference.
Yes, and that's a good segue to the IPPR report, because restarting Sure Start was one of the key policy suggestions there, and I think it's something that few people, you know, on this call would disagree with, that it was a really good programme, and when it disappeared there was a lot of angst and sadness, and I think it has had an impact on our society. So I'm going to leave it there with you, Gus, but you're part of the panel now, and I'm going to introduce other panel members one by one to introduce themselves and say a little bit about what they are, you know, who they are, and what they're about, really. So the first guest that I'd like to bring in is Priya Kumar, Dr. Priya Kumar, and Priya is a GP partner and health inequalities lead at the Kumar Medical Centre in Slough, and part of the Spine PCN. It'd be good, Priya, if you would be able to introduce yourself and explain, you know, what you're seeing of the change process. I think from the service lens is how, you know, you're coming at this, and what does change look like through that lens? So over to you.
Thank you, and hopefully I can give Lord Gus some hope that some of us in health are thinking differently and about the wider determinants of health, and we know that 80% of the problem is outside of health, and how do we start to facilitate our stakeholders, our people, our communities to really be part of that change, and how do we start to devolve power, which we have a lot in the NHS, to those communities. So absolutely on that page. And as Marion said, I'm a GP at Kumar Medical Centre and part of Spine PCN, which also includes Farnham Road Group practice. And we serve a population of about approximately 42,000 patients, and we are probably the most deprived PCN in the whole of from the ICB. So we have a real understanding of what's our people come in with every day, and we know most of the problems are not health, it's work, housing, you know, their education, what's going on in the household, the stresses of 2 jobs, people not being able to access health, and really that generational change, as we call it in Slough, is what we really, really want to get down to. And we know that there are social and environmental factors that could have been put in place in much earlier to prevent chronic disease that we see, and we're at the sharp end of the health inequalities. And perhaps that's why there is slight focus on NHS, because people do come to us, and we do see that. I mean, what I have seen in primary care over the last couple of years is the introduction of social prescribers and health and well-being. That is just the tip of the iceberg, though. At least there's that movement and that appreciation by the NHS that there is something we need to do. You know, the Marmot review, why we haven't succeeded is because we haven't listened, and we continue not to listen to our communities. And really, you know, the Core 20+5, the Health Alliance, this great movement I'm getting to be part of, actually, in my generation, is actually liberating to see what we could do in the future in the NHS. And it goes down to simply understanding individual needs. And as I said, it's the tip of the iceberg with the social prescribers and wellbeing. So how do we really devolve power to our communities? How do we really start to do that? And, you know, interestingly, within our PCM, we did open up the Britwell Hub in May 2024. So we were one of the first to open up, and we just opened up the community centre. So within our Britwell Hub, we have a library, we have a GP practice, we have a space for communities to come, we have gardens, and we just started small, a few different, work well sits there, depth, toddler groups, youth groups come along, and it's all about connections. That's what I'm hearing today. It's about connections and bringing the community back together, giving people confidence, agency, and control, as our chair said at the beginning. And it's actually evolving. And the real leadership is the residents. They're spreading it to the next resident, saying, come down here, we can really start to work together. We're about to start our work well bid, where we do have access to the data to understand those that keep asking for sick notes, and how do we intervene earlier. There's some data out there saying if the first sick note, if it's requested again after 4 weeks, that's when we go down the slippery slope of chronic illness. So how do we intervene at that 4-week stage? What is going on in that person's life that is leading them not to be part of a working life, and those connections that we need to see? So we have nearly 60, 70 people turn up to the Britwell Hub on a Thursday. We've opened up another hub on the Wexham site on the other side, because we can see the benefits our communities are having. And it's slow evolving, but at least it's different. And we do put services in there like physiotherapy, dietitians, but that's secondary to what the needs of that community are first off. And, from the service lens, we've got lots to do. We need to create universal care. How do we outreach to these underserved populations, as we see? And as that has been reiterated by colleagues on the call, I think we focus too much on the acute, like the targets we see within the NHS are A&E targets, waiting list initiatives. How many doctors, like you're saying, how do we get to long-term targets and preventative care, and how do we take our population on that journey, where the MPs and politicians are worried about being re-elected, and build that narrative with our communities. So that's a little bit about what we're doing in health, but hopefully you'll get a snippet of where we hope to move to and create this collective movement. Thank you.
Thank you, Priya. And I loved that point about building the narrative with communities, and that's sort of work to be done, isn't it? We'll come back, I think, probably, I'm sure it'll be raised at some point about the too much focus on the acute, and what about measures of prevention, or what about focusing on health inequalities or health inequities. So I'm going to introduce the second guest now, and this is Professor Donna Hall, who I suspect may need no introduction to many people here. Donna, is very well known. She was a member of the IPPR Commission on Health and Prosperity that ran for 3 years, and she's currently a non-executive director of Mutual Ventures, and formerly she was chair of New Local and an NHS trust in Greater Manchester, and also CEO of Wigan Council, where she led that transformation of the local authority and NHS through the well-known Wigan deal. So we're very honoured to have you, Donna, on the panel. And as an IPPR panel member, because we had originally invited Chris Thomas, who headed this commission, but he's been whisked away to Department of Health and Social Care. But you valiantly have stepped in, and we're very grateful for that. And because he couldn't do public speaking, so but the IPPR Commission has got 5 reports out, and one of the questions I wanted to ask you, it does feel as though, although they're saying some of the right things, it does feel as though they're coming very much from a policy lens. Did you get that sense of that? And did you get a sense that the IPPR commissioners, individually or collectively, know how to make change happen and know how health is created? Big questions for you there, but you introduce yourself first. You've got 5 minutes.
Oh, thanks, Maren. No, that's a really big question. I think it was a really good commission led by Lord Darcy, and really very diverse group of people looking at coming in from different perspectives, economic, health, local. But yeah, ultimately it was there to influence a new government coming in. That was the whole idea behind it. So my background is kind of delivery on the ground locally. I think I did the first ever Sure Start in Salford with Hazel Blair's, Gus. So thank you for that. It really did make a massive difference, and I totally agree that that has got to come back in some way. My only plea would be, from a Treasury perspective, not just capital, not only capital, because we ended up having to build loads of buildings because the lion's share of the money was capital. And so for me, that really opens up a question around the kind of, because I think there is another lens that we're missing a little bit, Maren, perhaps, that the Alliance could think about. And that's kind of leadership and place. So some of the really great stuff that Gus has mentioned happening in Greater Manchester, the Be Well initiative, but also more recently the Live Well initiative, where Andy Burnham has basically relinquished, he's devolved job centres. So job centres have now become Live Well centres that are very much about getting people, particularly long-term unemployed people in the cohort that Gus mentioned before, into employment through a broad range of support that is not just about going on job search skills or polishing up your CV. It's actually about removing a tattoo on your head that says, pardon my French, F off, or sorting out your teeth, or giving you confidence, things that have just not been dealt with and wouldn't be dealt with by any service. They're the things that we just miss when we commission services. We don't think about the reality of people's lives. So I think that thing about place and central government relinquishing that power. So I think saying to places like Andy is just chomping at the bit to get the best for his communities, isn't he? I met him the other night and he's just like a machine trying to fight in some ways the Whitehall system, which shouldn't be the case. You're battling with DWP, battling with a Department for Health and, the NHS central control of the integrated care system. That shouldn't be the way it works. We need, and the state, as Gus said, is the most, I think probably one of the most centralised in the world. So we do need to think about power, relinquishing power to place in a really meaningful way and stepping back. You see some of the good initiatives that have happened. So the Wigan deal, which was about a social contract with citizens. We are equal partners in this. We are not doing things to you, we're doing things with you. And that's kind of got to be at the heart of the government central local relationship too, that it is a social contract with place, and that we need leaders who can step up and give them that permission to innovate at the local level. You look at the Gateshead work, another kind of bubble, if you like, through Changing Futures, which was a great experiment, really great. But what's not happening with Changing Futures is it's not infecting the rest of the system locally with that relational way of working with people at the local level. So Greater Manchester, Gateshead, Wigan, some great examples. And they kind of did it despite the system, really. So this thing about brave leaders who are not individuals, but they are systems who can listen to communities, who can invest in communities. The reason we added 7 years of additional healthy life expectancy in Wigan wasn't because of the way we organised ourselves or devolution, really. It was because we invested 13 million in 500 preventative community-based projects that we didn't commission centrally. We did it. We asked communities, what do we need to support you with? Good mental health, with good physical health. We work with all the assets in the community, Wigan Warriors, all the local charities and sporting organisations, and got people into a much better place with their health. Maren, you know this, you've worked in Wigan, you've been there and you know it and you've lived it. So I think it's got to be about a radical model of place leadership, which is much braver, which is much more, starts with a person, not a service. Some of the things that those people coming into Andy's Live Well centres need are not services in the traditional sense. They're what Prayers just said before about a social connection, someone to love, somewhere to live and something to do. Going back to all the kind of Marmot principles. So yeah, the commission was good. I think there are other things that I would point to. The Reform latest report, which is quite radical in saying get rid of NHS England and give money directly to place, which is, I don't know whether we'll ever go that far, but I think the thinking behind it is that power will never go unless we start with that radical place model. Thanks, Maren.
Thank you, Donna. That was excellent. And the question of leadership, we sometimes talk about leadership in terms of everyone can lead. This is about dispersed leadership, no matter where you are in the system. And our job is to create the conditions for health, and to be created, but also to remove barriers. And I think that probably is the start of getting to this idea of how can we be brave leaders, how can we spot those barriers and remove them. But I suspect there's further to go in terms of your radical model. So we're sort of thinking about leadership from the ground up, and we've got our next speaker is leadership and enabling, let's say, from the ground up. And our next speaker is someone who leads one of those community community centres. So Dawn Shepherd, very pleased to welcome here today, is the coordinator of the community-led Dartmouth Community Trust, and that serves the whole of Dartmouth and the surrounding villages. And the community CAF that Dawn might mention is at the centre of that activity. And this is, part of the place where the group works in partnership with a range of services. So, coming to you, last Dawn, so you've had a chance to hear everyone else. It would be great to hear more about what you're doing, and how do the people that you work with and see day to day in the community CAF, how do they see change happening, and what might be in that space that we talked about, because I know you are working with service providers.
Hi, my name's Dawn Shepherd, and I've been coordinator for Community Chest for the last 16 years and town councillor. And we run a community CAF and we support Dartmouth and the surrounding villages. It's completely community led. We are all of us, top to bottom, volunteers. No, we don't have paid staff. We're a rural area, and we're the end of the line for a lot of the services to come here. We're sort of an island because we've got ferries one end and a long drive the other way, and services don't tend to get to it, or when there's a policy that starts off at the top, by the time it gets to us like years later, we've already moved on and the town has changed by then. So we decided just to train our own people up to fill those roles, because no one was coming in the way we needed in our rural area to deliver. We had people parachuting, and this was the 6-month project we had to get involved in, or nothing else. And we never had any say in what we wanted as a community. So we trained our own, and the people that do the jobs now, like Senkos and mental health, and they're all locally trained people. So it creates that resilience instead of dependency. We do work with services, but we don't tend to say we work with services. We work with good people in the services that get that, because there can be so much damage done to communities like ours and the work we've done together for 16 years if we let someone in who doesn't get that. So we work with good people in the services that come to our town, the ones that actually get community-led work. The problem we have with our having no paid staff is they don't see us as professional, because apparently you have to be paid to be a professional. So they don't take us as seriously as they should, unless they need something, and then we're professional. But if we need something, you're just a volunteer. So in the CAF, we've just created our own health, wellbeing support. We have a warm space this time of year that runs for 6 months. We have a men's group, mental health group, SEN group, all the things that we didn't decide to do any of these. People came to us and said, this is what I'm struggling with. And we did it together. We connected 24/7. You don't get a minute from them because they, anything that comes up, if it's dealt with instantly, it doesn't become the big stuff. So we focus on all the small stuff. We focus on the, we have to work with the other stuff as well, but we focus on the small stuff. And it's, something's broken. We get hold of the housing, because that being broken could stop them showering or something. And the knock-on effect of the small stuff becomes the big stuff. So we work on that, because people forget the little stuff. And then you get to a point where you are in this country where people, have gone to the doctors for anxiety, depression, and like 12 years later, they're still on antidepressants and they haven't had a job. Where we work on the anxiety and depression when they come in. We do hot meals through the year in the CAF. That are cooked from surplus food from the supermarkets, and they're very well thought of about nutrition, which we know from working with the GPs, we're lowering cholesterol and all the other stuff that comes with bad diets. And then we teach people to cook, because a lot of people, especially we've got about 6 men at the moment who are bereaved, and the wife did all the cooking, and so they don't know how to look after themselves, and that becomes vitamin deficiency, and that becomes not going out, and their health declines, and then they become isolated. So we teach them how to cook, or they can take food home. Everything is done together. We do everything together. We hate the labels we're given, so we fight back against them. We are not hard to reach. They're just not trying hard enough to reach us. We don't recognise that in our community, because as soon as we're about 7,000 people, which in the scheme of things is not a lot, I suppose, in these areas across the country. But we have a really good network. I always say the internet might be slow here, but the gossip's quick. So we rely more on the gossip than the internet. And someone will say, or the postman, I haven't seen Mrs. So-and-so for 2 days, and we're there. So we don't just knock on the door saying, why haven't you been out for 2 days? We go around with a meal, say, we've got surplus food, would you like some? And then usually you get someone break down at the door, and they let you know what's going on. So there's no hard to reach in our community, and in a lot of the communities we work with, because we have a rural cluster in the rural towns like ours that do this, and we stay connected to them, and they don't recognise these hard to reach labels, because we make sure everyone gets what they need. And the resilience that comes from that, instead of the dependency on someone coming to save us, makes everybody feel better. Well, we do work with the Exeter, the C2 C2 connecting community, that's what it is. And during the cost of living crisis, we do these what's worrying you, what's great, what's not, these they can just write on post-it notes. And the cost of living crisis, not one person in the room mentioned it. They didn't mention the cost of living crisis, because we have a safety net we've created ourselves that they know they can come to. So that's what we work on here in the community. That's what we work on.
Lovely. Thank you, Dawn. There's a lot in there as well. We've got 4 fantastic contributors here, all with something really important to say.
Oh, Merrin's frozen.
I think Merrin has frozen. But if I'm right, ladies and gentlemen, and I followed the agenda, she was going to pass on to me as the next step. So I shall ask for forgiveness rather than permission, which is actually something that I think has come across as a bit of a theme in terms of what communities do when they do things right. Let me introduce myself quickly. My name is George Fielding. I am an ambassador for the Health Creation Alliance, with a background in social care and community development. I was the youngest person to set up a CQC registered care provider, and delivered residential care and home care across the country to about 250 individuals. Then during COVID, I decided that it proved itself to me that communities are the people that care, and the fact that social care is so broken that sadly, although it's fueled by beautiful people, the system is so broken that half the time it's not social and it doesn't care. So I have the absolute beauty now of leading, of working with the likes of you and doing this from the ground up. So what have I heard from our panelists? I've heard a lot about space, connection. I've heard a lot about the fact that this is already happening, the fact that we might not be measuring the right things, the fact that the right measures we are invisible to the right measures, and the fact that actually solidarity comes from, and resilience comes from, not being heard a lot of the time, and the fact that we might not recognise the ability of communities to move faster than the mechanisms and in society to actually solve their own problems, and a lot of this, as I said, is about giving communities permission, the opportunity to be heard, the fact that there's a deficit of agency, and how can we as a society move beyond that, to understand that in a lot of rural communities and a lot of urban communities, there is the same level of absolute poverty, but for different reasons. That's come across. And it's been an absolutely fascinating conversation, but one that demonstrates that health creation is a process. It's happening. That we know through all of us on this call that we can do it. It is being done, and the fact that there needs to be a radical shift in how things are funded, designed, co-produced to enable health creation to be legitimised. And I just simply say that actually the manifesto, the asks, the professionals, the methods are all there, and there are people that want to give power to communities. All you have to do is listen to us and allow people like us in the room. But to give the floor more to our beautiful panelists, may I first ask Priya a question? Priya, I was incredibly moved by your focus on listening, and if I can give a friend of mine who's on this call, Charlie Jones, a shout out. We all require spaces for listening, and so what do you think can be done to ensure that everybody has the psychological, the physical, and the resource to give themselves spaces to listen, so that we find the answers in the end?
I think, thank you very much first, George. I think we need to just redesign the whole system. Let's just, go flat and go and listen to our communities and ask them what they want and what service they want. We're making assumptions about what services they need from a medical perspective, but that doesn't mean we're improving their quality of life. And therefore, actually, I think we need to move to a real, and consultation is the wrong word as well. I don't like that either, because consultation feels very tick boxy, and that still doesn't feel like we're actually listening, because it's the questions we're coming up with that we're asking our communities. What are the questions our community want us to answer, and want us to start to create and really change that narrative? I'm going to go into a case because honestly, it's really changed my life. I'm saddened we've gone back from COVID, where we started to get that social movement. That saddens me that we brought in all the red tape slowly back to where we were, that we could have actually, as I say, I think the NHS digitally has catalysed itself significantly in COVID-19, but socially we were almost at the pinnacle of changing things. And then we just reversed it straight back with all the red tape. It was fascinating. And the changes that we saw in our communities at that point, and the connections we made, particularly in Slough, have really benefited me and my community the last 5 years. The one case I can tell you about is I had this young family that came in. This young lady kept coming in, and at the end of the day, she was so broken by the end of it. Her and her 3 daughters were living in a car, and she finally told me what was going on. And because of all the relationships I actually made during COVID, and because I worked so closely with the VCSE and the housing, I knew the housing person. I would have not known the housing person 3 years ago. I rang them up and go, this is what's happening to one of my families. And it was that relationship, that connection, that one-to-one. I knew where to go to, because it was something I would not have known previously in health because of all the different connections I now have. And we got that family into a hotel or temporary accommodation within 24 hours. And actually, that family now comes and says to me, there is nothing that anybody else could have done more for me. And it wasn't fixing their, colitis, or it wasn't fixing their, cold or cough. It was simply giving their 3 daughters a safe place to live. And that's where we really need to start to, and when we talk about relationships just with our, community, it's also relationships with our partners, our schools. They have a wealth of knowledge we're not sharing. Which children are coming in? Which ones aren't getting food? How it's, and it's not always about the hard data. And I'm with the Lord Gus here. I love data. It is also about the soft intelligence. And that's when we shift from just understanding the data to creating the movement.
Thank you. There's an absolutely beautiful comment in the chat, if I may repeat it. It's from Clive that says that the spaces exist. The spaces exist. They are just currently mothballed, and the spaces exist within communities. They are just mothballed and wrapped up in red tape. We don't need to create spaces. We need to listen to the people that are already in the listening spaces that are called communities. But what you've said there about partnerships, about every organisation having wealth of knowledge and breaking down the silos in the systems and the invisibility in the silos. I think that kind of segues. I think that segues to the question that, if I may, I'd love to ask Donna. Donna, you talk about the need for radical kind of place making and a focus on place. But local trusts and organisation I've worked with before have a neighbourhoods commission out at the moment, and we talk about communities. So without trying to be too forensic, is there a difference between a place, a community, a neighbourhood, and actually isn't the way that we try and decipher and determine this language, do we not get in the way of ourselves in actually just devolving the decision making, because we don't know who we're devolving it to and what the distinctions are? Has language got in the way, or is language important in this regard in terms of what we mean by each of those terms?
Yeah, it's a brilliant question, that, George. Thank you. I think we can wrap ourselves up, can't we? And every think tank or organisation probably has its own perspective on this. And for me, I think we use anthropology a lot in the Wigan Deal, ethnography, so the study of how communities develop and work together and what makes a community tick. And we retrained every public servant in the NHS and housing and the council and DWP in how to listen to citizens properly. I know it's a really basic thing, but it's not part of kind of medical training and other things, is it? In local government setting, we're there to assess people and refer them rather than, and it's a parent-child relationship. So, I think it's got to be, again, going back to relationships, but a shift in the whole role of public servants in a local place, and also the respect that they should have for communities. We found we were giving tiny amounts of money to communities and then micromanaging it to such an extent we were spending more on the micromanagement than we were actually giving. So it's about, for me, it's not about language as much as about trust and shift, and about seeing yourself as equal to the people that you're there to serve. There's, putting the servant back into public servant. I think, as soon as you start drawing lines on a map, George, people will fall out about it. Oh, that's not my neighbourhood. That's that. And what about communities of interest within a place? But I really do agree with Priya. I think the two most trusted units of public service in a neighbourhood are schools and GPs. So we kind of wrapped everything around schools and GPs. And made those the kind of central hubs for where we would get that soft as well as the hard intelligence about who needed support. The police were brought into it, housing associations, everyone kind of wrapped themselves around those hubs and supported amazing stuff like Dawn has just explained. I think what you're doing, Dawn, is brilliant, and you know, all power to your elbow. And the fact that you're doing it in your own time is remarkable too. But the impact you're having is more than, I bet you, public services are having in your local area, because you're building those bridges and building people up. Is that okay, George?
Of course it is. I say this all the time, Donna, but sometimes the risk is in doing nothing at all, and actually the need to define public service and put the public back into service and redesign the system, that's coming across again and again. If I can segue to you, Donna, your most powerful reflection, if I may say so, amongst many things you said, was that that we're professionals when when the system wants something, but volunteers when we're volunteers when professionals want something, but volunteers when we want something. And so there's a mismatch here, and you know, in my time in care, I realized the biggest workforce is volunteer care, unpaid carers, and the biggest workforce that our public service has at the moment is volunteers. What would you like the system, the professionals in power, to do to take the pressure, if indeed there is a pressure, off the volunteers in rural communities like yours?
Well, I think everyone wants to be treated equally. For a start, we're all experts in our own life, you know. We don't need someone parachuting in and tell us how to tie our shoelaces, you know. So we need to be taken seriously. You know, if I walked into well, I'm on here now, I'm a volunteer with all these amazing people, and I'm being listened to and taken seriously, hopefully. Why can't they do that in communities? Why, if a group of people, professionals, come to my town and I'm, you know, in my old jumper cleaning the loo, am I no longer a professional? I think it's rude. I think it's really rude. They have no idea of my background. They just see me cleaning the loo and think, well, she won't know what she's on about. So I think we need equality, right from the top to the bottom. But one of the biggest problems we have, well, first of all, space. You know, I always say space, the final frontier in our communities, because we're like these beautiful seaside towns. Everything costs a fortune. You know, when they can sell a garage for £150,000, you know you're in trouble. So these spaces come at a premium. I had to sell my soul and become a town councillor to be able to hire a council building, because they won't take us seriously. And then I'm a town councillor, and now I know what I'm doing, and I hide the space. And it's really rude to think we have no idea what we're doing. It's rural communities have had to. I mean, I'm from an inner city. I know how they both work, and rural communities have had to do this forever. You know, when this was a farming community, they've had to rely on each other, and that was taken away from them, really. And the systems come in and said, we know what you want, and a lot of the time made it worse. We've got community back, and we will not let go of it. And I don't care who comes in here into our town, we will not let go of it. But it's like a takeover. We have people coming in and it's like, oh, we love what you're doing. It's absolutely amazing. Can we come in and ruin it? And then can we write a report without you knowing you're in the report about how great we are? And can we, so we're very careful with our, you know, people's personal information.
Thank you, Dawn. Before I segue back to Gus, who will no doubt have a lot to say on everybody's reflections.
Who's in the room? I'm so sorry.
Oh,
I'm so sorry.
No, I can hear. We can hear you now. We can hear you now. Can you hear me?
Yeah, it's the rudeness of writing about us as if they had some part to play in it, when all they've come really is come in, took and gone. And we have a name for them, but I'm not going to put it on here because it's swearing. I'm just going to charge my laptop.
No, absolutely. Dawn, whilst you're charging your laptop, can I give you 2 minutes to answer this question for me? A lot of the poverty in rural areas goes missing because it happens in smaller numbers, but it's in fact deeper. Because of the lack of infrastructure, lack of transport, lack of green spaces, the inequity in poverty, the seasonal economy, and all of these things that you know so well about, so much about. You've also talked about how those empowering systems often use extractive methods and kind of without crediting. And so there seems to be a difficulty or a dichotomy in rural communities that the real problems aren't seen, and then when they're seen, systems use the wrong methods to try and extract the knowledge. Is that a fair reflection, and is there something you would add to that, kind of in terms of the methods that you've seen don't work, and that we need to move away from when we're making this radical shift?
So language is really important. So when they write these reports about us, all I see in our community, I see a strong, resilient community that kind will go out of the way for each other, and we have built that. You know, people notice things now going on in the community that probably didn't notice before because they had become shut off from each other because of policy, a lot of to do with policy. And then somebody comes in and looks at our community for 5 minutes and calls us all these names like disadvantaged and deprived and all the names that make us, we never said that was okay. The language they use about us, then if we read that,
it's cut out in full flow, but I think we got the message there. Gus, we all must have sympathy for an incredible amount of professionals like yourself in public service, trying to do public service well, and there are mechanisms and opportunities that abound right now with a new government, with the new missions. May I ask you, in this conversation, with 100 people on this call, what is the one thing that you think we're missing and that Keir Starmer and the Labour government are missing that could plug this hole to create this bridge that we're trying, and this new space we're trying to design? Is there something that we can all go away and do and provide you, all members of civil society, to make sure that there isn't this divide and this misunderstanding that we need to solve, not just for the sake of ourselves, but for the sake of the health of our communities in general? What are we missing, and what do we need to do about it?
Well, I think what I would say you're missing, and you're not going to like this, is an understanding of why the system is the way it is. So if you think about why is there all that red tape? Yeah, why don't they devolve more? It's obvious. It's surely it should happen. And the answer is the incentive structures at nearly all of the levels. If you're a local councillor first, right the way through to being a civil servant, you have things like the National Audit Office. They are never, ever going to do a report on anything you've done right? They are not interested. So there is massive risk aversion built in. You know, we have a lot of bankrupt local authorities, right, who've done stupid things. And you know, if you're sitting in the Treasury, you're saying, so you want me to give more money to these people so they can buy up shopping centres? You know, like, how ridiculous is that? The red tape is a really interesting point, you know, and I think one of the really useful things that people could do here is say, so what are the regulations you would like to see abolished? What are the things that you would like more freedom over? And then once you write them down, you know, thinking about, well, okay, that's good because good people are going to do this well. What are the implications for the freedoms you might give to bad people? And one of the other things about devolution, this came out of the pro bono economics research, was actually, and my wife is a volunteer for Citizens Advice Bureau, right? actually the capacity of the voluntary movement is much better in richer areas. And so there you build in, the more you do this, the more you actually enhance inequalities potentially. Now, I'm very keen on volunteering. Just one plug. I've been talking to Radio 4 on Boxing Day. They're going to do a guest editor thing on volunteering. So just to kind of make it that I am so with what Dawn was saying about what people were saying about the value of volunteers and communities. You know, they can do so much more. And this is why it comes back to measurement. You know, we value them at precisely 0 in our accounts. So, you know, that is one of the reasons that it's not there. So I would say really focus on that question of what are the things you would like to change? What's the issues about regulation? Where are the areas of devolution that you'd like more control over money? And how can someone who sits at the top, who is accountable for that money, then be able to say it's fine and not be dragged before the NAO for saying, how did you let these people go away and then do these terrible things, waste this money? That's my kind of slightly negative, but I have to say, you know, I think we all saw the power of communities. You know, I'm a London boy, right, born and bred, and it's, to me, what happened during COVID with people knocking on the door saying, does anyone need me to go shopping? Does anyone need me? You know, and this tragedy, I think it is a tragedy, is that it's stopped. And, you know, it's somehow I thought this might be the start of people changing their perceptions and creating things. I mean, yeah, we have Nextdoor, you know, .com, which is kind of filled something of a gap, but it's not as big a change as I'd hoped for. Let's put it that way.
Fantastic, Gus. The message is loud and clear, and you are and you are and have done for a very long time led the change on this, and it's such a pleasure for me with one of my other hats on to hear you talk about the power of volunteering. The vision for volunteering was launched in 2022. I launched it, and it talks about experimentation, diversity, power shifting, all of the things that are in the Health Creation Manifesto. You know, there's an agreement about the principles and all the things that are needed here. In the 10 minutes that we have left, can I ask again, in kind of spirit of Merrin earlier, crowdsourcing, what are crowdsourcing solutions? What is the legislation that you'd like to be abolished? The people in this room, kind of what freedoms would you like that would make your job easier? What are the solutions that come to the top of your mind? If you want to put them in the chat, then of course a blog. This is all being recorded and will be kept and shared. So please do have your say. Just what you said about, final question, what you said about people never writing a report about what's going well. Sadly, that's true in my experience, but it's one of the old adages of asset-based community development and all the approaches and health creation here. We need to make a shift from sickness to health, but also from what's wrong to what's strong. And are people in the system just ground down by negativity and process? Is it paralysis by process, or is the underlying, or are they burnt out, overworked themselves? What do you think lies behind this focus on kind of negativity and risk, kind of as a human behavior?
I think it's partly the way we have media. You know, all the planes landed safely yesterday. It's not a story, right? No one's really interested in things that are working and going well. They want to write the story about something going wrong. So, you're always going to get that, and social media is going to enhance that, because you will see, you know, in order to get clickbait, you have to be provocative, and in order to be provocative, you talk about something that's going wrong. So, you know, there is a kind of inbuilt bias in societies that is going to move us that way, as the way our media evolves and the way people exchange information changes. So it is hard, but building more community. Dawn was talking about the communities where there's a lot more social capital put in, right? And I particularly pick up on Donna's point that actually, you know, creating more money for investment. A lot of the government thinks of that as physical investment. You're right, roads and buildings and that. I'm not. If you just took a small fraction of that and invested it in social capital, invested it in making Dawn's life a bit easier by actually, you know, saying, here's a pot of money. I'm not going to tell you what to do with it. You know what to do with it. Go off. You know, that to me would be really worthwhile. And if you think of it in live well centres or in job centres as they were, you know, there is some scope, some discretion given to frontline staff when they see people in dire need, and maybe we need to think about, should we be expanding that discretion, because you know, this society is capable of great things. You know, I've just been talking to some people who are involved in the Homes for Ukrainians. I mean, it is unbelievable, the people that open their homes, the number of Ukrainians that came over, the way local authorities worked. And a lot of this, I was talking to the PermSec in charge of it, a lot of this was the government just stood back and just said, there are people that know about this, and they just passed it on. And actually, it wasn't a central government program, it was all devolved, and it worked incredibly well. So, but again, you know, who's going to write a story about that? Just to say a thank you to all the people on this call, because I think you do amazing work, and don't ever think that people don't recognize it. I just wish we could give you more power in a way that's also accountable, I have to say.
In what I hope is a smooth flow back to Merran, our Chief Executive Officer, who we had the pleasure of working with at the Health Creation Alliance. May I just say thank you, Gus. Your emphasis, your work, your history on this shines through. Thank you to all of the panelists. The solutions are in the people in this room, and it's an absolute delight to bring everybody together to connect virtually and physically. Dawn, I can't wait to be back in Dartmouth. Donna, can't wait to be in Wigan. We know the answers, and there are people in systems out there that want. We all want progress. We all want better health. We all want mastery. We all want agency. It's about building that new space, that bridge to doing so, and hopefully, the Health Creation Alliance and other things that we're all a part of will be part of the mission building moving forward, and on that, because the people on this call are leaders. We all are, and it's an absolute pleasure to be alongside you. Back to you, Merran.
Thank you, George, and thank you, everyone. And in a couple of minutes before we end, I'm just going to go and ask you, each one of you, to say just your top thing in 20 seconds to go into this space. And by way of summing up, and I was only off the call for a few minutes. Apologies for my Wi-Fi complete failure. Not sure quite what happened there. But thanks, George, for picking up. You've done an amazing job. Just by way of summing up, I'm conscious that we've talked more about health than about the economy, but I think we know that health, you know, is so important for the economy, and if we could only get that, I think I've got a sort of list of things, but there's so much more in the chat. I didn't manage to pick it all up in the conversations, the richness of them, but I'm just going to mention a few things really that we think should go in this space. Language. We need to be cognizant that we do speak different languages, but we don't always mean different things. So that is always going to be something that we're moving towards each other on, and that's okay. We can speak different languages. The small stuff is important. So the small stuff and the big stuff, and how we get that connection going through. Because of course, if you don't sort the small stuff, it escalates. Obviously, connections, relationships, and removing the divisions. People with a voice. in positions of power, from people like Dawn, from the community angle, but all of us really. I think the spaces exist already. Physical spaces exist. One of our reports we did a while back talks about physical spaces and the need for them, but also the need for emotional space to reflect, and the need for system space to just take a step back and create that space for communities to do their thing, but actually support them to do it. I think that's at the heart of this place-based leadership, and I'm going to talk more to Donna about that and how we might build more of sort of articulate that differently and build more of that in. But listening, training and listening is another thing I picked up. Spending money in the right way, really difficult. And Gus mentioned, that the difficulty there. Supporting people without judgment, paying volunteers, and actually enabling people to get jobs in local organisations. Part of the, part of this dynamic between health and housing. I think one thing I really want to say is respect and humility. We all need that in this space to be able to sort of bring all the elements together. Community knowledge, understanding of the VCSE, and I'm going to look at the RHDI later. Gus, thank you for that. But if the VCSE is not sector and what it creates is not understood as an economic measure and not included, is that a blind spot in civil servants and others, perhaps health professionals sort of mindset in terms of what its worth is. We really need to change on that. And I think lastly, I'm going to say the people who care need to be in this space from all parts of the wider system, because it is going to be difficult. Gus, thank you for just painting that difficult picture. I've been told by many people this is really, really hard and it hasn't yet been done. So we need to be together looking through the different lenses and keep going. So with 1 minute to go, Gus, Priya, Donna and Dawn, what one thing would you put in to this space? And then
we didn't mention it, but this government's very mission led. The mission boards, I want there to be representation on the mission boards from the social sector that understands about communities and all of this, and that actually has the dimension. At the moment they're thinking about private, public sector. No one's thinking about nearly all of the people on this call. That's my one.
Thank you. Great, we can help you there hopefully.
I want to move to preventative care that engages lifestyle changes and community-based initiatives. Stop with these acutisms and the hospital care. How do we really start to shift the NHS targets for us to change behavioural change within the NHS?
Thank you, Priya. And Donna?
What makes change happen is the title of the seminar. Communities make change happen. Trust them, invest in them, get people like Dawn to teach us that new public management is a busted flush. It's not been here forever. It was only created in the 80s. Let's scrap it and think of something new.
Thank you, Donna. Excellent. And Dawn?
Oh, am I on? Yeah. Well, for our communities, remove the barriers, stop chucking barriers in our way and watch the community grow. We can make your life so much easier. The outcomes are what you can never imagine. Just stop blocking us from doing what we know is needed because we live here. This is our lives and we can't stop doing it because this is our lives. We're not a project, this is our lives. So stop chucking things in our way and let us grow.
Thank you, Dawn. Removing the barriers, a key leadership challenge there. So I just want to, we're over time, but I want to thank all of our speakers. Thank you so much, Gus, for joining us today. Thank you, Priya. Wonderful to hear from you and stepping in at the last minute. Thank you, Dawn. It's been excellent having you again on one of our calls. And thank you, Donna, as well. It's wonderful always to work with you. And we will, by going along this route together, we will make progress. To everyone on the call who's still here, please complete the evaluation. We will send the video around. Please become a member if you would like to, or opt out, but we hope you will join if you're not already a member of the Health Creation Alliance. We hope you enjoyed the session and we do hope to see you at future events. So thank you very much and we will close the meeting now. Thank you.